I have also worked with Dr. Sunita Fotedar, at least for I think 3-4 years.
That's such a privilege.
Yeah. And I rather shared a chamber, OPD chamber. We were sitting together when she just joined service. And then she later on moved to Swami Dayana Hospital. And there she was working as an HOD. She was very a down-to-earth person and very dedicated. She never said no to any job assigned to her. So she joined as a specialist, like because when we were in LBS hospital at that time in 1999, there was a shortage of other casualty people and all. So we were assigned all kinds of duties. And she being a gynecologist, she never refused, I'll not do this, I'll not do that. I'll just take to only gynae performance and all that. And we used to share a lot of personal talks also, because sitting together, you share so many things with about her children, about her husband. Her husband is a pediatrician. I think everybody must be knowing that, Dr. Arun Fotedar. I keep meeting him off and on in some for some cases and all. And she was really a wonderful person. And the way she lost her life, she struggled very hard with her disease. But ultimately, she succumbed to that. And I think her daughter is also a doctor. I don't know more about her son, but her daughter is a doctor also. And Dr. Chitra will be speaking on for oration for Dr. Sunita Fotedar, and she'll be speaking on domestic violence, which is a very upcoming subject, and not exactly upcoming. Government is doing a lot of things along with sexual assault and what government is doing, like making centers for that. Like one-stop centers are being created in different districts and all that. So domestic violence has also been integrated with the sexual assault victims, and so that they don't get a stigma. So they are being coordinated and being taken care of under one-stop centers, which the government has started planning. And I think initially they are doing only one center per district, and there is a lot of protocol for that. I think Dr. Chitra will discuss that. If she doesn't, then we can elaborate later. Dr. Chitra, please.
Dr. Kalpana is writing, I'm unable to join. What happened?
मैं शेयर कर लूँ अपना वो?
हाँ कर लीजिए.
You entire.
Yes, ma'am. Please share your screen.
And share.
The oration.
Share your entire screen के बाद I'll again press share.
Yes, ma'am. उसके क्लिक करना पड़ेगा मैम विंडो के अंदर. जो छोटी विंडो खुलती है ना, उसको क्लिक करिए and then you
share बटन हाईलाइट होता है.
Share बटन not हो नहीं रहा है.
जो विंडो खुली है ना, उसके अंदर एक बार क्लिक करिए, तभी वो शेयर हाईलाइट होएगा.
हाईलाइटेड है बट
शेयर करिए, फिर प्रेस द शेयर बटन.
स्लाइड शेयर कर दीजिए.
आ गया? अब आपको लोग को दिख रहा है?
हाँ जी मैम, आपको दिख रहा है? मैम नीचे जो वो बार खुली हुई है ना, स्टॉप शेयरिंग के बगल में हाइड है, उसको क्लिक कर दीजिए, सो दैट बार विल गो आउट. हाँ जी, हाइड कर दीजिए. Yes, done.
Okay, good afternoon everyone. I would like to thank Dr. Shardajan ma'am for giving me the opportunity to talk on something on Dr. Sunita Fotedar's oration. Today I remember my dear friend Sunita Fotedar. She was a very kind and nice personality who left us last year. I pay my homage to her and pray for her good life. Wherever she am I not audible?
नहीं, आप audible. Full screen कर लीजिए डॉक्टर चित्रा. Full screen. Make it full screen.
It is full screen only.
It is okay.
नहीं full screen नहीं है.
Full screen है.
ये small window में ही खुला हुआ है.
Full screen है मैम. Full screen है.
Full screen.
Okay.
And please go ahead. And I request other participants in the meeting to please be muted.
Dr. Komal, you need to mute yourself.
Today I will be discussing a very important and sensitive topic whose awareness is not limited to the education, but it is important for our lives also. It is domestic violence, the abuse. What's abuse? If you alter your behavior because you are frightened of how your partner will react, you are being abused. Definition of domestic violence: any act that harms or injures or endangers the health, safety, life, limb or well-being, whether mental or physical, of the aggrieved person or any other person related to her, to meet any unlawful demand for any dowry or any other property or valuable security, is domestic violence. Globally, violence against women, particularly intimate partner violence and sexual violence, is a major public health problem and a violation of women's human rights. Estimates published by WHO indicate that globally, about 1 in 3, 30% of the women worldwide have been subjected to either physical or sexual intimate partner violence or non-partner sexual violence in their lifetime. Most of this violence is intimate partner violence. Worldwide, almost 1/3, that is 27% of women aged 15 to 49 years who have been in a relationship report that they have been subjected to some form of physical or sexual violence by their intimate partner. NFHS survey: in India, 30% of women have experienced domestic violence at least once from when they were aged 15, and around 4% of ever pregnant women have experienced spousal violence during a pregnancy. Recent data on states from the 5th NFHS 2019 to 2021 show the states that continue to have the highest rates of spousal violence in country is Karnataka, Bihar and Manipur. Now, forms of domestic violence. Physical violence. This is slapping and pulling the hair, pushing her, throwing her in a room, not giving her food, and even burning. This is physical violence. Emotional violence is shouting at her, abusing her, insulting her in front of others, and even abusing her relations. This is emotional violence. Sexual violence is any sexual act, attempt to obtain a sexual act, unwanted sexual comments or advances, or acts of trafficking. Economic violence is not letting her opening an account, not letting her doing any job, not giving her money for her expenses, not giving her money for her household expenses. This is economic domestic violence. Risk factors for both intimate partner and sexual violence: lower levels of education, a history of exposure to child maltreatment, witnessing family violence, antisocial personality disorder. Some people are very suspicious. If he sees her wife talking or laughing with someone, he feels that she is cheating him and he misbehaves with him. Harmful use of alcohol. Sometimes they come drunk in the night and then they shout at her and even beat her. Harmful muscular behaviors, including having multiple partners. Community norms that privilege higher status to men and lower status to women. Low levels of women's access to paid employment and low level of gender equality, discriminatory laws. Now, factors influencing women victims: continued tolerance of abusive relationship. First is conflicting emotions. This is very common. If he shouts at her or he even slaps her sometimes, she feels that he is otherwise okay. He loves me, everything is going fine in the house, but sometimes he gets irritated, sometimes he gets angry, and he does behave like this, but does not matter. She tolerates that. Maternal instinct: if she feels that if we are separated, what will happen to the children? So because of the future of the children, she keeps on tolerating the abusive relationship. Economic dependence: she does not have money, she does not have any other house to go, so she has to tolerate whatever is being done with her. Social pressure: yes, in our society, we say that when you get married, that husband's house is your house, you have to manage there, you have to adjust there. This is how she has to live. So she thinks that if I complain, anybody who will help me, instead they will make fun of me, or they will criticize my family, or they will laugh at me. So she keeps quiet and keeps tolerating. Gender inequality: yes, in India we have a patriarchal society. It is always male dominant society, and she has been knowing this right from her childhood, so she keeps on tolerating. Physical weakness: women are not weak, they are never weak. In my personal opinion, they are not weak, they are very powerful, but all these above factors make her weak. Impact: violence can negatively affect women's physical, mental, sexual and reproductive health. Lockdown during the COVID-19 pandemic and its social and economic impacts have increased the exposure of women to abusive partners and known risk factors while limiting their access to services. Situations of humanitarian crisis also lead to new forms of violence against women. Then health consequences. These fatal outcomes like homicide or suicide, injuries in almost 42% cases, lead to unintended pregnancies, induced abortions, gynecological problems, and sexually transmitted infections, including HIV. 1.4 times more likely to have a STD, and in some regions HIV, also twice as likely to have abortion. Intimate partner violence in pregnancy also increases the likelihood of miscarriage, stillbirth, preterm delivery, and low birth weight babies. 16% more likely to suffer a miscarriage and 41% more likely to have a preterm birth. Can lead to depression, most post-traumatic stress, and other anxiety disorders, sleep difficulties, eating disorders, and suicide attempts. Can also result in headache, pain, syndromes like back pain, abdominal pain, chronic pelvic pain. Actually, she is not well mentally. Since she is not well mentally, she is not well physically also. And so she keeps on complaining pain somewhere or the other. Impact on children. Children who grow up in families where there is violence may suffer a range of behavioral and emotional disturbances. These can also be associated with experiencing violence later in life. Intimate partner violence has also been associated with higher rates of infant and child morbidity and mortality. For prevention and response, this is very important. A woman should be respected in the society. R is relationship skill strengthening. E, empowerment of women. S is services ensured. P is poverty reduced. E is enabling environments, schools, workplaces, public places created. C is child and adolescent abuse prevented. T is transformed attitudes, beliefs, and norms. The Protection of Women from Domestic Violence Act, TWDVA 2005, an act to provide for more effective protection of the rights of women guaranteed under our Constitution who are victims of violence of any kind occurring within the family and for that matter connected therewith. Rights of the aggrieved person. In PWDVA Act 2005, the right to make an application for obtaining a relief by way of protection of order, an order for monetary relief, a custody order, a residence order, a compensation order, or more than one such order under this Act. Rights of the availability of services of service providers, rights of the availability of services of protection officers, right to free legal services under the Legal Services Authorities Act, and right to file a complaint against Section 498A of the Indian Penal Code. Now, where to complain? She can complain in the nearby police station. The police station, and if they are separated, she can complain to the police station who is near her husband's house or in-laws house and or the police station near her own house. If they have gone for a vacation and she faces a violence there, she can always go to a police station nearby Chennai or Bangalore, wherever they have gone. Now, protection officer. Protection officer is a person who is appointed by state government and he is there in all districts. She can go and complain to her also, to him. Then magistrate. Magistrate is in the court. She can go and complain to the magistrate. Magistrate will ask for hearing within 3 days, and then within 3 days he will call the accused, and then he will pass the orders for a release. Service providers. Service providers are the NGOs. They are the voluntary associations which are registered under state government. They can give shelter to the victim. They can help in medical aid and legal aid. Anganwadi workers are there in all the mohallas. They have complaint forms. The victim can take the complaint from there and she can fill the form and go to the police station or court wherever she can. And if she cannot go out of the house, she can always ring on 1098 Women Helpline. All India Helpline is the National Commission for Women that is situated in the Sola institutional area. It is open on all working days, Monday to Friday from 9 a.m. to 5:30 a.m. It has its emails and WhatsApp numbers, so she can complain there. Role of clinicians. Violence against women is preventable. The health sector has an important role to play to provide comprehensive health care to women subjected to violence and as an entry point for referring women to other support services where they need. Role of the health sector. Advocate to make violence against women unacceptable and to be addressed as a public health problem. Provide comprehensive services, sensitize and train healthcare providers in responding to the needs of survivors holistically and empathetically. Prevent recurrence of violence through early identification of women and children who are experiencing violence and providing appropriate referral and support. Promote egalitarian gender norms as part of the life skills and comprehensive sexuality education curriculum taught to young people. Carrying out population-based surveys and studying violence against women in demographic and health surveys as well as in surveillance and health information system. Never forget that walking away from something unhealthy is brave even if you stumble a little on your way to the door. Thank you. Thank you so much.
Thank you so much, Dr. Chitra ma'am. It was a wonderful presentation.
Very well spoken.
I invite Dr. Amita Saxena ma'am for her expert comments. Ma'am, please unmute. Amita ma'am, please unmute.
Yeah. Am I audible?
Yes.
Yes.
Yeah, at the outset, I'd like to thank Dr. Shada Jain ma'am and Dr. Chitra. I'd like to congratulate her because she's very comprehensively covered this topic, which shows, like she's already specified, the magnitude of this problem is immense. And I think we as gynecologists in this forum should be aware because most of the lady patients come to us, and if we can, apprise them, because so many of the disorders which they have, if you examine them thoroughly, you get to know that it's related to some other issue other than just medical. It's some social issue, whether it's violence. And for that, I just like to use this forum to apprise you that, the government has opened 11 one-stop centers, which are called Sakhi centers. And these are there in 11 hospitals of Delhi government in nearly every district. For us, for East District, I'd like to say GTB has got one and Lal Bahadur Shastri has got one. Now, I'll just tell you briefly what these one-stop centers are, which are also called Sakhi centers, because Delhi DNs of the administrators of the East District, that is DN, has named it as Sakhi to make it more friendly. Because, here, like what we were talking, like generally what happens when there's domestic violence and when you tell the victim that to go to a police station, they have a hesitation and invariably they avoid going to the police station. So these Sakhi centers are very friendly for these victims. They can come there directly without bothering to go to the police station. And here we have a counselor. We have all the facilities which are required. A police constable is there, a lady duty constable is there who registers the FIR at that one-stop center. That means at that particular spot, everything is available. Her legal aid will be provided, her medical aid will be provided, her police, whatever formalities are required will be provided, as well as, of course, all her health needs will be looked after. So this is a very good initiative, and we have 5 beds also in these one-stop centers for destitute women, who are found by, and some of the general public might get them. So these people can come directly to these ones. Anybody, they can just ring up CATS ambulance, or if not CATS ambulance, just dial 100. The police PCR will get them to this one-stop center where all their needs, medical, social, psychological, as well as their legal and police formalities will be taken care of. So that's a good thing, and they can stay there because we've got 5 beds where they are well looked after. So because you get a lot of, our area is such, our hospital is surrounded by resettlement colonies where this is a very frequent. We have as many as 50 to 60 domestic violence cases per month. So you can imagine. So I just like, and of course, above all, I'd like to use this opportunity to to talk about Dr. Sunita Fotedar, and I feel I'm really lucky to have known her in Lal Bahadur Shastri Hospital. A very sweet, polite person. She used to draw patients like like bees coming to her. This thing because of her nature. She is very accessible, very sweet, and very, very humane. Thank you so much for making me part of this forum. Thank you.
Thank you.
Thank you so much, ma'am. Thank you so much.
Dr. Neerja, ma'am, your comments,
Yeah.
ma'am.
Yeah, I just wanted to add, Amita has highlighted almost all the aspects of domestic violence and one-stop center. I just wanted to add that domestic violence is not related to a husband-wife only. That women can complain against any member of the household, and if she is sharing the household with a person, like she can complain against a male member sharing household with her. So it's not between husband and wife. Either if a child has been adopted, that child can also can complain against for domestic violence. And One Stop Center has also integrated this Juvenile Justice Act and POCSO Act. They all things have been integrated in One Stop. And what, like Amita has said, like people are not aware of it, and legal aid people are really not aware of it. So I was just reading an article, news item. Like Justice Lalit is going to be the new chief justice. He is very famous for doing NALSA. He is the chairperson of NALSA, that is National Legal Authority. So he is going to different places in India, and I think he's covered. He has almost covered 1.5 million villages to publicize like what legal aid they can get. Every court has a legal cell, helplines women. Anybody can go and have a free legal aid there. So these are the initiatives which have been taken by the government, and they are trying to include even the transgender, disability, and these are the things they are highlighting on. So initiative is a real good one. And like we said, people don't want to go to police centers. So that is why the One Stop Center has been created, where all kinds of facilities are being provided. Even they have been given monitoring rehabilitation, like if compensation orders and protection orders, Chitra has already covered. So these are the things they are trying to do. And if some hospital, like we are talking of Delhi, but in other cities, or if a hospital doesn't have a space for one-stop center, government is providing a space and finding a space where they have at least 5 rooms, and they are trying to construct those spaces, and these things are being done by the government. So I think it's a very huge topic, and Chitra has covered it very concisely. Thanks, Chitra.
Thank you.
Thank you so much, ma'am. Thank you so much. I think we can move on to the next oration.
Before we go on to the next oration, Dr. Kalpana Kumar has just joined.
Okay.
Dr. Kalpana, ma'am. Dr. Kalpana, ma'am, we have a few words about Dr. Sunita Fotedar, then we'll move on to the next oration.
Is she there? She's not there.
She's joined.
नहीं दिख रही
नहीं है,
She's not
नहीं.
there.
She's not there. She's not there.